Hey there, and welcome. If you're here, chances are you or someone you love is dealing with some pretty uncomfortable stomach pain, and you're looking for answers. We're going to break down exactly what appendicitis is and what you can expect, in a way that's clear and hopefully calming. Okay, let's get right into it.
You know the one? It's that pain that just makes you stop what you're doing. The one you can't really ignore. Look, it is totally normal to feel worried when your body is sending you signals that you don't understand. Your concern is 100% valid, and just getting some clear information is a huge first step to feeling more in control. So let's walk through this whole process together. We're going to look at the signs, what happens at the hospital, the actual treatment, and what recovery looks like. The whole goal here is just to pull back the curtain and demystify everything for you.
All right, first things first. Let's talk about the symptoms. How do you even know if this is something you need to get checked out? Well, it turns out your body has a pretty specific way of letting you know.
So what even is the appendix?
It's just this little finger-shaped pouch that hangs off your large intestine. Appendicitis happens when that little pouch gets blocked, and it can be blocked by something as simple as a hard little piece of stool or even a foreign body, like something you swallowed. When that happens, bacteria get trapped inside and it gets all swollen, infected, and angry. So when you go to the doctor, they're basically playing detective. They're looking for a very specific pattern of 4 key symptoms or symptom clusters. Let's break down each one so you know what they're looking for.
This is the classic one, the big one. It's often called migratory pain because it literally moves. It usually starts as this kind of vague, dull ache right around your belly button. But then, over a few hours, it starts to travel, settling in as a sharp, really constant pain in your lower right abdomen. Now, this one's a little strange, but it is a huge clue for doctors. Rebound tenderness is when the pain actually feels worse, not when the doctor is pressing down, but in that split second when they quickly let go. It's a really unique, telltale sign that there's some serious inflammation happening under the surface. This is one you can absolutely notice yourself. The pain from appendicitis gets way sharper with any kind of jarring motion. You know, think about coughing, or a big sneeze, or even the jolt you feel when a car goes over a speed bump. If that little bump makes you wince in pain, that's a pretty significant clue. And finally, the pain almost never comes alone. Your whole system kind of gets thrown off. We're talking about a low-grade fever, feeling nauseous, maybe even vomiting, and a big one is a complete and total loss of appetite. Most people just say, I am not hungry at all. The thought of food is, nope. Okay, so you've recognized the signs, you've done the right thing, and you've gone to the emergency room. So what happens now? Well, the main goal is to get a crystal clear diagnosis as quickly and safely as possible. So this is super important. A bunch of other things can actually feel like appendicitis. Think kidney stones or even certain infections. So a doctor's first job during that physical exam is to carefully feel around your abdomen to pinpoint the pain and make sure it's not one of those other culprits. It's all about making sure you get the right treatment. The process from here is really methodical, kind of like a checklist. After that physical exam, they'll almost certainly do some blood tests. What they're looking for is a high white blood cell count. That's basically a signal that your body's immune system has sent out the troops to fight an infection. After that, they'll move on to getting a picture of what's going on inside. When it comes to imaging, there are 2 main tools. An ultrasound is often the first choice. It's fast, easy, and uses no radiation, which makes it perfect for kids. But for adults, the CT scan is really the gold standard. It gives this incredibly detailed 3D picture of the appendix and can show for sure if it's inflamed or even if it has burst. So, once the diagnosis is confirmed, the conversation is going to shift to the solution. And when it comes to appendicitis, the fix, almost always, is a surgery called an appendectomy. Let's talk about what that really means. All right, take a deep breath because this is the single most important thing to know. Removing the appendix is an incredibly common procedure. Seriously, it is one of the most routine emergency surgeries performed in the entire world. Surgeons do these every single day. They've got this down to a science. These days, most of these surgeries are done laparoscopically. Think of it like keyhole surgery. They make a few tiny little incisions and use a camera to do the work. The big advantage is that recovery is so much faster. The only time they usually need to do a more traditional open surgery with a larger incision is if the appendix is already ruptured. That just gives the surgeon more room to get in there and wash everything out to prevent any future infection. Now, you might have heard about just treating this with antibiotics, and you might be wondering about that. It is an option, but only in very rare, very mild, and uncomplicated cases. The reason surgery is still the standard is because it's the only way to be 100% sure that the problem is solved for good and that it will never, ever come back. So the surgery is done, it was a success, you did it. Now we get to talk about the best part, the road back to your normal life. What does recovery actually look and feel like? You will probably be amazed at how quickly you can bounce back. Most people are home within 12 to 24 hours. Yeah, the first 48 hours are going to be the most uncomfortable, but the pain is definitely manageable with medication. The key is to get up and start doing some gentle walking as soon as you can. It really helps the healing process. The only major rule is no heavy lifting for about 2 to 4 weeks, just to give your muscles time to heal up properly. And here it is. This is the biggest question, the biggest fear people have. Is my life going to be different now? Do I have to change my diet? And the answer is an absolute definite no. Removing your appendix has no effect on your digestion, your diet, or your long-term health. You can go right back to living your life exactly as you did before. Okay, just one last but really crucial piece of information. Once you're back home and recovering, you need to know what to watch out for. Think of this as your aftercare checklist.
These are the specific warning signs that mean you need to pick up the phone and call your doctor right away. If you develop a high fever, if you have vomiting that just won't stop, or if your abdominal pain suddenly spreads out across your whole belly and feels really stiff or hard, any of those are signs you need to get checked out immediately.
So we have walked this entire path together, from that first confusing symptom all the way to a full recovery at home. Knowing what to expect can really turn that feeling of fear into a feeling of control. So the only question left is, if your body is sending you these signals, what's that most important first step you can take? Thank you so much for watching.